PAD350 seeks to ensure health and well-being for all at every stage of life. To ensure healthy lives and promoting the well-being at all ages is essential to sustainable development. The goal addresses all major health priorities, including reproductive, maternal, and child health, communicable, non-communicable, and environmental disease, universal health coverage, and access for all to safe, effective, quality, and affordable medicines and vaccines. It also calls for more research and development, increased health financing, and strengthened capacity of all countries in health, risk reduction, and management. The effort that needed to fully eradicate a wide range of diseases and address many different persistent and emerging health issues. By focusing on providing more efficient funding of health system, improved sanitation and hygiene, increased access to physicians, and more tips on ways to reduce ambient pollution, significant progress can be made in helping to save the lives of millions. At least 400 million people have no basic health care, and 40% lack social protection. More than 1.6 billion people live in fragile settings where protracted crisis combined with real national capacity to deliver basic health services present a significant challenge to global health.
Mercy Malaysia is an international non-profit organisation that are focusing on providing medical relief, sustainable health related to the development and the risk reduction activities for the communities, which is in both crisis or non-crisis situations. Mercy Malaysia also relies on funding and donations from the organizations and generous individuals to continue their service as providing humanitarian assistance to our benefits. They are constantly on the lookout for the partners to fundraise with their humanitarian works. One of the programs was held under Mercy Malaysia is obstetric and midwifery program, which was held in Syria. The funds required for this project is 517,000 ringgit Malaysia, and the project period was start in September 2018 until September 2019. The long-drawn war in Syria was destroyed basic facilities such as hospitals, schools, education center, and others that are affecting millions of people. One of the worst affectors are the children and youth who face a bleak future. Mercy Malaysia Obstetric and Midwifery Program is the one of its kind in Syria that are training young ladies on basic nursing and midwifery to help young in refuge settlement to deliver their baby safely. The service provided is highly critical in this nation where the healthcare system is crippled by conflict.
Contribution of the program to sustainable development. Running a social organization requires a lot of hard dedication and hard work. In the last 2 decades, the organization has provided humanitarian assistance and programs in 32 countries in crisis and non-crisis situations. Mercy Malaysia has also evolved into a full-fledged humanitarian organization offering the full spectrum of humanitarian services from emergency to response to rehabilitation and recovery, mitigation and prevention, and disaster preparedness. Some students left college when it became unsafe to continue attending classes. Some were too poor to afford further education. Some were seeking ways to change their life and help their country. For the young ladies who enroll for the midwifery program, it is a life-changing knowing that they will be able to conduct life-saving procedure for women in labor. So, the contribution of the program to sustainable development that has Mercy Malaysia's implemented by midwifery program, whereby this program is the first of its kind in the war-torn country that will increase the number of trained midwives and improve access to reproductive health services in the war-torn nation. Upon graduation, students will be able to help women in refugee camps or homes deliver their babies safely. In relation to health, within the SDGs, there is recognition of the social determinants' impact on health and well-being. WHO recognized that the socio-economic circumstances of individuals and groups have at least as much and often more influence on health status as medical care and personal health behaviors. Some of the most important social determinants of health include poverty, economic inequality, social status, stress, education and care in early life, social exclusion, employment and job security, social support, and food security. The Sustainable Development Goals just don't relate to people in low-income countries, they affect all of us. The realization of this target will improve the life of people in our communities, our families, and even our own health. They are important because you are important.
Suggestion for implementation of this program is the first one is by creating a table for the expression of pregnant women about their worries to give birth in an uncertain state by helping them mentally to give birth and plan to conceive again. This is in order to release them from the shockers of anxiety before and after childbirth and help some extent control physical and mental problems. In addition, the value of staff commitment and support shown by staff at all levels is the key to project success. The executive teams help fix and solve problems. Department directors were very involved, showing their support for the project to their staff, and there is a strong commitment from local indicators and implementation teams to drive improvement in this field. And the last one is the Mercy Malaysia also needs to work harder to raise funds and use more creative ways to attract people to provide funds to make this program more successful so that it can increase the assistance standard and no one of them are left out and give the necessary completely. The conclusion is that from this third Sustainable Development Goals, which is good health and well-being, can be associated with this program because this third Sustainable Development Goals has stated that this is to ensure a healthy life and improve well-being at all age is important for development to continue, and significant steps have been made in increasing life competency and reducing some of the common killers associated with child and maternal death. These programs help women in the progress of pregnancy until childbirth and also help those who need help with healthcare.